research accident with biological material among hospital housekeepers in Brazil. This study received financial support from CAPES, and we declare no conflicts of interest. Even if the hospital housekeepers don't provide patient care, they are still in risk to have accidents with biological material because they handle medical waste. Many causes contribute for the increase of this risk. Like we show here in the slides, in the pictures. The picture A and B show the material they normally use in Brazil to clean the hospital facilities, and it's normally a squeegee and a towel, and for them to dry this after they clean, they need to wring out with their hands, and for if it has some sharp stick on it, can happen an accident with them. And the picture D, we can see that in basic healthcare facilities, the situation is a little worse because they don't have the properly personal protective equipment to work. When we talk about medical waste collection, the situation is still bad. Like in picture A and B, we see the workers don't have the adequate personal protective equipment, and the pictures D and E, we see that the place they work is not the most adequate, and like the D, near the waste storage, they have stairs, like we can see here, and in E, the sharp container is not mounted correctly. But the major reason for them to have accidents with biological material is the inappropriate discard of medical waste, especially the sharp ones, like we can see in the picture C. So this study is important because accidents with biological material among hospital housekeepers happen a lot, and when they happen, they are pretty severe. So the aims of our study were identify the frequency and the profile of accidents with biological material among hospital housekeepers, classify the conduct pre- and post-accident with biological material, and compare the profile of the first and the last accident among those workers with more than one occurrence. This study is a retrospective epidemiological study, and we used records of accidents with biological material among hospital housekeepers in the state of Goiás in Brazil. And here in figure 1, we can see where is the state of Goiás. The figure 2 show the source of information. We use 2 secondary sources of information. The first one were records of patients victims of accidents with biological material treated at a referral hospital in Goiás. And the second database were the state of Goiás database of notifications of accidents with biological materials. How we can see between these 2 databases have a period in common, which is 2006 to 2010, and that's why we did a probabilistic linkage using the software Link Plus to unite these 2 databases, and the result was the database tree. And after that, we took the records of accidents with biological material among hospital housekeepers to analyze in this research. We use SPSS to analyze the data, and we did this descriptive and inferential analysis, and values equal or below 0.05 were considered statistically significant. In this study, we had 11.6% of the accidents in those two databases were among hostel housekeepers, with a number of 996 records. This data is lower than international studies and higher than Brazilian data. 6.1% of those hostel housekeepers had more than one occurrence. When we talk about the profile of those accidents, we have that most of them were percutaneous, involved blood, had no identification of the patient source, the source patient, sorry. Most of them involved hypodermic needles and happened due to inappropriate discard of sharps. And this profile looks like other studies that's cited here in the bottom of the slide. 48.2% of the hostel housekeepers were vaccinated when they had the accident, and 39.1% of them weren't completely vaccinated against hepatitis B. Lower vaccination rates were found in studies in Africa and Asia, and one of their major reasons for that were the high cost of the vaccine, but this justification can be used in Brazil because the HPV vaccine is free for healthcare workers, and that includes the hostel housekeepers. When we compare the first and the last accident with biological material among those workers with more than one occurrence, we have that it's statistically significant, the difference between the first and the last accident when we talk about vaccine against hepatitis B complete. But even after the last accident, 14 workers didn't have their hepatitis B vaccine complete. When we talk about the comparison between the first and the last accident, when it's a percutaneous accident or accidents occur due to inappropriate sharp disposal, we have that the difference between the last and the first one is not statistically significant. And that kind of indicates a continual disrespect with the waste management rules. Table 3 shows the post-exposure conducts recorded among hostel housekeepers, and like we can see, most of them didn't have indicated post-exposure prophylaxis against HIV and HBV. And 30.8% of the records show that the hostel housekeepers abandoned their follow-up after their accident with biological materials, and only 13.6% had a successful termination of this follow-up. So with that, we conclude that healthcare workers need to be accountable for the waste they generate. Management should hold themselves accountable for the immunization status of their workers, as well their post-accident conduct and follow-up care, and continuing education programs that focus on waste management are essential for the entire healthcare team. Those are some references. Thank you.